Hi, I'm Gary White for Channel 6, Central Kentucky Television. I'm here with Dr. Trish Zacconi at Central Kentucky Optometric Associates with offices in both Lebanon and Springfield. And today, for our eye care news segment, we're going to talk about styes.
All right.
Now, what is a stye, first of all?
A stye is an abscess or an infection, either in a hair follicle or in a meibomian gland. They occur in your eyelids. Usually at the base of, if it occurs at the base of your eyelash, it's called, in the hair follicle, it's called an external hordeolum. And if it occurs in the meibomian gland, which are the oil glands that line the top and the bottom of your eyelids, it's called an internal hordeolum. And an external hordeolum sometimes will just respond pretty well to just topical treatment of warm compresses. But sometimes they need an oral antibiotic too. Internal hordeolums, generally you need to put hot compresses on them, but often you need to have oral antibiotic to get that to resolve. Both can lead to what we call preseptal cellulitis, which is an infection from the eyelid, but doesn't go back to your orbit. There's a little septum or tissue that kind of creates a little barrier there. Or in extreme cases, if they progress to orbital cellulitis, that is a very serious life-threatening infection.
Really?
So you really want to treat these styes seriously. You want to get your treatment quickly. Don't wait, until your eyelid is so swollen shut or until you have double vision to come in and get them treated. And generally most respond really well to treatment early stages, and you can prevent some of the more serious complications.
So it's spring now, and spring is a time when you see a lot of the styes, right?
We do, and a lot of it has to do with the fact that everybody's getting outside again after a long winter's nap, and we're done hibernating, and we're getting outside, and we're getting exposed to all the pollens, and our eyes start itching from allergies, and we start going up here and rubbing our eyes and inoculating our eyes. Our meibomian glands often get a little inflamed from allergies, and they get stopped up, and here come the styes. So we see a lot of styes or hordeolums, external and internal. We see them a lot more frequently in the spring than we do other seasons. We see them all year round, but it's just spring is a hot time for them.
Absolutely. And what are some of the symptoms, or how would somebody know if they're having a stye?
Generally, one of the first things that folks will notice is a little discomfort when you blink. Almost, it feels like a little prickling and just a little soreness of the eyelid when you blink. And then you kind of look in the mirror and you can see it starting to get a little red there and starts to swell. And then, a day later, that whole eyelid starts to swell and it's hard to keep it open. So a sore, swollen, or sore spot on the eyelid or a sore, swollen red eyelid is generally. And again, you don't want to wait until the eyelid is so swollen that you can't open it or that you have double vision, because those can indicate that the infection has gotten much more serious.
Yes.
So.
And it's not something, if you do have these symptoms and they're starting, they should come in right away, right?
Yeah.
Because it's not something that will potentially just cure itself.
Generally they don't. The external ones could resolve on their own a little more readily than the internal ones, but the internal ones generally, they all need treatment. The hot compress, everybody at home will probably heat up a washcloth and with hot water and slap that on there, and then it's all dripping down. And that's okay, but it's not the best way to do it. We use what we call a brooder mask. These are masks that have moisture beads inside them, and you heat them up, and you don't put them in water or anything, you just heat them up in the microwave, and they retain the heat a lot better. You can get them two-sided if you have one for each eye, or if you're prone to styes a lot. For some people who have what we call meibomian gland disease, we'll use this on a regular basis every night. Or you can get them one-sided, where you just heat it up and put it on one side there. But you put them in the microwave for 20 or 30 seconds and heat those up. They would just retain the heat a lot better. You can, we call it the poor man's brooder mask. You can make one at home. With a sock. You can use a big long tube sock, or you can use two little socks, but you can put some uncooked rice. Don't cook the rice, just uncooked dry rice, put it in a sock, tie it off, and you can use that. You can throw that in the microwave. The disadvantage of that is the rice doesn't smell very good when you heat it up in the microwave, and it just doesn't retain moisture like the beads and the brooder mask does. But the dry rice in the sock is still better than a wet washcloth with hot water on it.
And what are some people should they be doing to prevent themselves from getting a sty?
Well, if your eyes itch, come on in and get an allergy drop, and let's treat the allergy and reduce that. When you go out to mow or to work in the yard or to go run outside and the pollens are out, wear safety glasses, sunglasses to shield your exposure to the pollens. Another thing you can do is put an allergy drop in your eyes right before you go out. That sometimes has helped. Oral allergy treatments are helpful for some people. So wearing a hat can help, reduce your exposure there to the pollen. So some people, it's good they wear a mask. If you wear sunglasses and a mask over you if you're mowing and tend to be prone to allergies. So you want to block the pollens from getting into your eyes and your nose, and you want to treat with mast cell stabilizers and antihistamines.
Absolutely. And also, as we did say, it is spring, so people are going to be outside in the yard. And even if it's not for styes, you still want to be careful with your eyes and do wear protective eyewear.
Absolutely.
Right?
It's time to protect your eyes from the sun when you're out there, and also from flying projectiles when you're out mowing and weed eating. And just don't, if you miss a spot weed eating, and don't go back and get the weed eater and say, oh, I'm just going to turn this on and do this one quick little spot. Go get your safety glasses first before you do that, or leave it till next time, because that's when a lot of people get hurt. They say, oh, I normally wear my safety glasses, and I was done and I saw a spot I missed, so I was just going to go out there and get it and didn't put my glasses on. Put those glasses on every time you rev up that mower or that weed eater or the bush trimmers. A lot of people, that's another thing, is trimming bushes is when people hurt their eyes.
Absolutely. So be careful this spring, and if you do have any eye issues, be sure to come and see the folks here at Central Kentucky Optometric Associates with offices both in Lebanon and in Springfield.
Yeah, absolutely.
Well, thank you very much. All right, this has been Gary White for Channel 6, Central Kentucky Television.